You know, I tell you that gas prices are up, and I feel like I don't really need to tell you gas prices are up. You know that. You know all the prices that are up: grocery prices, gas prices, childcare costs, Medicare premiums. They're all hitting record highs. The standard premium for most Medicare enrollees is now $2,435 a year. Childcare is rising faster than inflation. According to Care.com, the online childcare marketplace, or it's a care marketplace, the average parent reports spending 20% of household income on childcare. Remember, President Trump campaigned on making life affordable for everyday Americans. But now that he's back in the White House, he says those costs are not his problem. Literally. Here's Trump recalling a conversation that he had with his budget director, Russell Vought.
I said to Russell, don't send any money for daycare because the United States can't take care of daycare. We're fighting wars. We can't take care of daycare. You got to let a state take care of daycare, and they should pay for it, too. They should pay. They have to raise their taxes, but they should pay for it. And we could lower our taxes a little bit to them to make up. But it's not possible for us to take care of daycare. Medicaid, Medicare, all these individual things, they can do it on a state basis. You can't do it on a federal. We have to take care of one thing, military protection. We have to guard the country.
You can see where this is going, right? Because there's a budget proposal out there that asks for a lot of money for military stuff, not government's role to pay for silly things like daycare and childcare and, Medicare and all the things with care in it. Our taxpayer dollars will not be spent on vital services like healthcare and childcare. Mind you, dozens of developed and developing countries provide free health care for all. Every single other developed country, we call them the OECD countries, every single one of them, plus many more, have some form of universal health care. But America is the only developed country in the world that doesn't have universal health care, by the way. But the priority here, according to President Trump, is war. Donald Trump's current war against Iran is estimated to have cost taxpayers more than $16.5 billion in the first 12 days. We're 5 weeks into this thing. That's according to the Center for Strategic and International Studies. But you can Google this. It's all over. All sorts of places have made estimates on this thing. It's day 35, and the Pentagon has not released updated figures. But according to the Washington Post, over 4 weeks, again, we're in 5 weeks now, the U.S. military blew through 850 Tomahawk cruise missile strikes against Iran at a cost of more than $3 billion. $3 billion just in Tomahawk missiles, all right? So let me put $3 billion into perspective. That money could have funded cancer treatment for roughly 28,000 Americans, food stamps for more than 1 million people. It could have paid for a decade of salaries for 3,200 nurses, according to an analysis by the journalist Mina Arshad. And the average cost of daycare for one child is $17,264 annually. So the $3 billion in Tomahawk missiles for a war that we don't understand why we're in could have paid for 173,000 children's daycare. But the message from the White House is clear. War comes first. Joining me now is Aaron Haynes, editor-at-large of the 19th News and an MS Now political contributor, and Kathleen Sebelius, who served as Secretary of Health and Human Services under President Obama and is the former Democratic governor of Kansas. Welcome to both of you. Thank you for being with us. Kathleen, let's start with this. This is not complicated. You know this from your days as HHS Secretary. It's not actually complicated. It's a matter of a government committing to doing something that would help a lot of people. Donald Trump has just said, not the government's job. Daycare, childcare, Medicare, Medicaid. This is not the government's. War is the government's job. That's a decision. That's not a fact. That's just a decision.
Well, nice to be with you both. Budgets are priorities, right? They're a statement of where you spend taxpayer money. I mean, first of all, there's so much outrageous about the statement that Donald Trump just made. First, he doesn't understand the programs at all to say that Medicare, which is a 100% federal program, should be done by the states. They need to do it. Just means he has no basic understanding of a program that supports the 10,000 Americans a day turning 65. Childcare, one of the most important expenses that people have. I'm a grandmother of 5. I know how expensive it is. I know what working parents are trying to do, struggling with making sure their kids are safe and secure and educated and making sure they can go to work. So this is the president's priority. He's made it very clear. his priorities war, and often he gets distracted by ballrooms. It is not about the services and supports that the American people rely on and need to go about their everyday lives. The good news is, Allie, is that we have a vote. Congress puts the budget numbers together. This is the president's message to them. This is where I want you to spend taxpayer dollars. The voters will have a chance to say to this Republican-led Congress, and hopefully to fire them if they follow this line, we want money spent on America. We actually believe in America first, and that means feeding our kids, having them go to school, having health care, being able to buy a house, not involved in bombs and wars that have nothing to do with the United States.
And no clear explanation. Aaron, before the break, I played that thing that J.D. Vance said. He's got a total solution to health care, all right, to have grandma take care of it. And I appreciate that, Kathleen probably does a fantastic job of helping out her kids with their children. But that's actually not what most developed countries say. It's nice if you can have your grandparents take care of your kids. And a lot of people make that choice to try and stay. It's fantastic if you can have that happen. But most governments understand that everybody can't have that happen. I want to just put up on the screen how universal child care would benefit the economy. The Center for American Progress published this in 2022. It lowers costs for families. It boosts their spending power, which then boosts the economy. It stabilizes businesses by reducing worker turnover because people don't have to quit to take care of their kids. It encourages labor force participation, which is kind of stuck at a level that we'd like to increase, and it supports parents' mental well-being and boosts their productive capacity. Again, not science. This is established fact around the world.
Correct. And Allie, I'm so glad that you're pointing this out and that you played those clips, because this is about Americans' ability to participate fully in our democracy, in our workforce, in our society. And this is what it looks like for democracy to really feel personal, right? It's not some abstract thing that's out there for the American people. It is something that is a literal kitchen table issue that, to Secretary Sebelius's point, could be motivating voters. They remember, how it feels when they have to make these decisions that are based on policy. Meanwhile, you've got a president that is focused on a solution in search of a problem for the myth of voter fraud, to your point. Yep. All of this is related. The American people want to be, they're focused on affordability and the economy, and they want their elected officials to do the same. So, what we heard from the president this week shows us where his priorities are, right? He's signaling that the federal government shouldn't be responsible for things like childcare or healthcare or even parts of the social safety net. That's a significant shift, right? It raises real questions about what happens to the millions of Americans who rely on these federal priorities. And the last thing I would say on this is we know that women are especially affected because they live longer, they rely more on Medicare over time, they're more likely to need the long-term care, and they're also caregivers. So this is not just about how this affects them individually, it's also about how this affects their families. And so, the burden is going to be on them.
Kathleen, I often talk about you as the former governor of Kansas and the HHS secretary, but before that, you actually won an election based on a word we use now all the time, affordability. It wasn't about affordability at the time, but it actually was. It was about insurance, right? And in the end, and I ask you this because there's an election coming up, and this falls under the rubric of affordability, right? Whether it's food stamps or it's health care benefits or it's Medicaid or it's Medicare or it's child care, it all comes under the rubric of affordability. And that was a message that actually propelled you into becoming the governor of Kansas.
That's right. It hasn't changed. That was a while ago, but people, not surprisingly, their concerns start at the kitchen table. They start about, can I send my kids to a good school? Can we live in a house? Can I feed my kids? Do I have a job that is going to allow me to retire? And then they can be involved in the community, be productive workers. So what other developed countries do, as you correctly pointed out, not only is provide universal child care, but they provide parental leave so parents get paid as they choose to have a family. They provide support for education. They provide health care. We have a president now who has announced from the podium that he doesn't believe that's the job of the federal government. He does not believe that the United States of America should be involved in providing those individual things, as if that's not the essence of what a family cares about. So it's very clear. It's words coming out of his mouth. We'll see what Congress does with his budget proposals, but it's a shocking revelation of where this president's priorities are, and they are not on American families.
And Aaron, the fact that all these other developed countries do this, they've all done the math, right? They all understand this makes for a more productive world. We've got aging societies. We need workers. America's decided it doesn't want immigrants anymore. I'm not sure who they think is going to do all this work because we have a declining replacement rate in this country. You need people to work. So if you don't create a situation where parents or mothers can actually afford to work, you create a whole other set of economic problems.
Absolutely. And I think, your viewers, I'm sure, are seeing what is happening in these other countries, what is possible in these other countries, and what it means for that safety net, what that makes possible for people in terms of their ability to participate, right, in our democracy. And so, this means access to healthcare, access to childcare could depend much more on where you live and what your state is willing or able to provide. You played that clip from Vice President Vance about the grandparents helping or states pitching in. This isn't just about one program, right? It's about whether these are national commitments, which the president has signaled that they shouldn't be, or something that's going to be left to individuals and states. And we know that that's not how it is in so much of the rest of the world.
Yeah, you're both right about this. This isn't about one thing. This is actually a sign of what the priorities are. But no one should be surprised because the president's comments, he talked about Russ Vought. Russ Vought wrote, he coordinated Project 2025, and all of this was written down. So this should come as no surprise to anybody. The only thing is you have a chance in November to do something about it. Thanks to both of you. Aaron Haynes is the editor-at-large for the 19th News. Kathleen Sebelius is the former Secretary of Health and Human Services under President Obama.